Some interesting things happen during clinical, so we'll talk about that. First, we need to fix the screen. There we go. And then we need to turn off. There we go. Got it. We're simulcasting over on the stack, which is great. That's me. So clinical yesterday was I did a post on it. If you didn't see it, I challenged my students to some math problems, and the sheer terror on their faces uh, was priceless. But we got through it. We figured it out. Good morning, Holly. Welcome in. Thank you so much. The Daily Corgi. Got my fresh William and Mary shirt on, brand new from the campus shop. I hadn't gotten new shirts in many, many years. They were getting pretty old. A horrible time to have this username. I don't know. What is it any worse than any other time? Holly, thanks for liking the live. Gotta have some coffee. All right, so there were 3 equations I challenged my students with yesterday. One was to calculate a mean arterial pressure based on a manual blood pressure. The other was calculate a manual drip rate and gave them all the information they needed. And then the last one was to calculate your heparin drip rate. So, Juliana, good morning. Thank you for the donuts and for the daily heart me. I appreciate that. Holly, also for the daily heart me. This is Brookie. Can stress cause your abdominal muscles to become inflamed? Stress alone? I don't know. That's not something I'm familiar with. I'm not saying it's not possible. But stress can have very real physical effects. Like it can cause a lot of physical symptoms. So, like I said, it's not something I've seen, but it doesn't mean it can't happen. So my students really struggled with those math problems. Long division really is what they struggled with. And I tried to teach them long division. They didn't know what I was talking about. Like, doing the you know, you put your big number, you draw a little box over it, you put your smaller number on the left, and you just add it in and whatever. And that none of them knew what that was. I had some older students, they knew what it was. But the other ones didn't know what that was. They used some other type of division solving. But I also asked, like, we'll just find the common denominator, and they didn't know what that was either. So yeah, we got to the answer, like, they got there, but just not with long division that I was taught, and I didn't know that there was I didn't know that there was another way to do that. Good morning, Amanda Donnell. Yes, it is very early. Apparently, any time is too early to do math, especially long division. So, they kinda struggled with it initially. They eventually got to the right answer, and that's the important part. How they got there is I don't know. I don't know how they do their division anymore. Yeah, apparently they're just not taught long division the way that we were taught. They are taught some other common core math or something like that. Away to me. Ooh, I actually made it 20 year lives. Well, I'm happy to have you. Welcome in. We're recapping my clinical yesterday, which was a good one. We got to see what we thought was going to be a thoracentesis that ended up being a chest tube. They, the physician came down, a couple of them came down, did the ultrasound, and then they were like, "No, no, no, this is too much. Like, we need to put in a chest tube." So they got to see a chest tube placed at the bedside, which they were super jacked about. What else do we have? We had one of my old colleagues who is now a nurse practitioner. She came in and did a suprapubic catheter replacement, which was really good for them to see. And then we had a Dobhoff tube placed. And I went back and saw the video, the recap, and I forgot to correct the auto caption for Dobhoff, and I don't even know what it said, but it was not Dobhoff. Do you guys always have to waste a drop of insulin or something when injecting? Do we have to waste a drop of it? I mean, we try not to waste anything. We do we do put we push the plunger up until it comes out of the tip of the syringe to make sure that we don't put any air in there. Amanda, thanks for liking the live. Appreciate that. I saw your post that you got more snow. I'm sure you're super excited about that. Shay, thanks for the follow. Thanks for liking the live. What can I expect from a sternotomy as a patient or as a nurse? So, I mean, as a patient, you're going to have sternotomy wires for the rest of your life unless they figure out another way to close up a chest. Gary, taking a guess what is going to happen to me when I'm admitted to psych? I don't know. It depends on what you're being admitted for. As a patient, so if they're having to put sternotomy wires, they're gonna have to crack your chest open and then use the sternotomy wires to put it back together. And from now until all eternity, when you get a chest X-ray, you're gonna see these sternotomy wires on there. Now, immediately following that procedure, like when you're in recovery, um, and this is something that they should talk to you about. But and again, I'm not a CV nurse. I'm not a cardiovascular ICU nurse. But what I understand and what I've learned is that they have a special crash cart for post-op sternotomy patients. So if you were to go into a cardiac arrest, there's a particular way that they have to address that, not in the traditional sense. Like they can't push on your chest. They have a special crash cart for that to literally open the chest back up and do it manually, like literally massage your heart. That is the way I understand it. If there's any CVICU nurses in here that understand that process better, and especially for a post-op sternotomy, please drop some knowledge in the comments and educate us all. Go Live Vegas in the house. What's going on? Is that you, Aaron? It is awfully. It's either really early or really late, depending on how you look at it. Do you use cisgender on your medical history form? Well, that's kind of a complex question. I work at the VA, so the current administration has been really cracking down on you know using people's preferred names or preferred pronouns. But as I have what I've seen is we still have preferred listed in their chart, and we still care for transgender veterans. So we still use preferred pronouns. But I mean, there's the way this administration is going, there's a push to like not do that, but I will continue to do that and they can fire me. Oh, you work better at night? Yeah, I got it. I've downloaded it. So we got I did pop punk. So this is I guess what they consider pop punk of the 2000s. So lots of comments. I'm trying to catch it. Bobby from Boston, good morning. As always, how's the weather up there? I saw Pennsylvania got more snow. I mean, it was chilly here yesterday, but not snow chilly. Michelle, thanks for the go popular. I appreciate that. Street MDs, a medic. What's up? I am but a humble EMT basic. So I'm not a medic, but I still run EMS in my free time, which there isn't a lot of it. Yeah, so it depends. Like in Vegas, it's what 3:30 in the morning. So yeah, it's either really early or really late. If you're still awake from yesterday, it's really late. If you just got up, it's really early. Yeah, that's what I tell people. I'm just a humble basic, man. I can only do so much. I usually drive is what I usually do now. Going to bed now. Okay, so it's really late. See, Albert, security at a hospital. Why does my ER try to force me to keep someone there when they don't have like a 1096? I don't know. Is that the code for psych? Um, well, we don't have security. We actually have a police force at my hospital, and so if they are planning to TDO somebody, then they can hold them there until they get the paperwork. ALS is overrated anyway. Well, I mean, there are definitely times where I'm like, "Oh no, this is an ALS call. This is beyond me. I know what to do. I just can't do it." I I don't know. I think ours is 1096 is what our 10 code is. Although they prefer that we not use 10 codes anymore, which I'm like, they still use them. You don't want to say psych patient over the radio because that's a public channel. Anybody can be listening. Anybody can look it up too. But Holly, thanks for muting that. Appreciate it. I didn't see it, but I saw you muted him. So well done. Yes, I do have a moderator in here. So behave. Zofran can also be slow administered over 12 hours if you have HG. What's HG? Tan Man. Yeah, I don't write the rules, but that is the recommended 4 to 5 minutes. Have I ever pushed over 4 to 5? No, I've never pushed over. That's the preferred. I morphine is at least 2 because if you push morphine too fast, you can cause chest wall pain, and that's where they get that heart attack feeling, and we don't do that. Oh, hyperemesis grabbing them. Okay, gotcha. I've never done a Zofran infusion before. Piper, how accurate is the pit? Pretty accurate, not 100%, but as far as medical dramas go, it is the most accurate representation of working in a level 1 trauma center that you'll find on television. Matthew Hicks, thanks for the follow. Anybody else done a Zofran drip? I mean, I work in the ER. They're typically not there long enough. We just do push dose, so we can give up to 8 for like every 6 to 8 hours. Thank you, Go Live Vegas. Thank you, Aaron. Appreciate it. I hope you get some good sleep, man. Hokey Gigi watched the live for 500 minutes. Woo! I don't know if I've watched my lives for 500 minutes, but I appreciate it. That's awesome. Got a couple more follows. Forever Wit and SD the OG, like that. Hendo was on promethazine IV, but they stopped doing it. Promethazine, is that Phenergan? I have to look that up. I want to say that's Phenergan. I could be wrong. Let's see. And the other thing my students say is that they don't have to know. Yeah, it is Phenergan. Woo, I remembered. Yay, brain. The other thing they say is they don't have to know brand names. They only have to know generic names, which I think is kind of confusing because we had to know both when I was in nursing school because some hospitals still use generic and the brand name. So yeah, that was the other thing they said. When I was in nursing school, the summer before your junior year, you were told to buy a book on med math, right? And it was your job to read that book. And then when you showed up day 1 of orientation for your junior year, you had to sit for a test, med math test. And you got 2 chances and you had to score 100%. If you didn't score 100% the first one, you got a second attempt. If you failed that one, you're out of the program. Like, it was the most stressful test I've ever taken. It wasn't particularly hard, but it was the most stressful because you put all this work into becoming a nursing student, and it comes down to this one test, and if you don't get 100, you're out. So, and there were some that did not, and they were out of the program and never can come back. That's how strict it was. Courage to Walk, Tennessee Nurse GG. Thank you for the follow. Appreciate that. Um, AKA Wingnut, is that what it is? Have you ever heard of Ehlers? Yes, one of my my best friend who we just went to visit of the weekend, his wife has Ehlers-Danlos syndrome. Yep. I'm not like deeply familiar with it. I understand it's a connective tissue disorder. It's genetic. I think her daughter has it as well. Daddy Doc, Lord of, I had to learn both for EMTP because you never know what the patient is going to. Right, exactly. You know, metotrolol. What are you on? What does that say? Tell me that again. What is the funniest mispronunciation of a medication a patient has ever given you? Agree. Away to me. Yes. Knowing both is important. Um, yeah, but having to look at isn't either. But I think having that recall, I think also is nice to have on hand. Yeah, nursing school is wild. Bionic Pixie. No, this live is for everybody. We live stream. We talk about nursing primarily, but we also talk about pop culture, music. I love music. I used to be a DJ back in my early days. And, we just kinda talk about whatever. I have ADHD, so we just kind of go with the flow. Like we see a squirrel, we're going to chase a squirrel. See a butterfly, we're going to follow the butterfly. Have I read Jeremy Renner's new book? No. Look, the stack of books at my nightstand is embarrassing. I have so many, and I'm reading. I kid you not. I have like 6 books that I read simultaneously, and it's really bad. I cannot buy any more books. I have so many books that I have not read yet, have not finished yet. I literally probably have 6 books that I'm actively reading right now. I have commitment issues when it comes to books and TV shows. I have a hard time finishing them. Like, I still haven't watched last week's The Pit, and the next episode comes out tomorrow night. Oh, so, Haley says we only do generic now. That's the way the nursing school does it now. But I agree. I think it's good to know both. Cauda equina, yes, I'm familiar with that. Compression of um, the spinal cord, and it can cause, loss of bowel and bladder control, pain. That is a emergency that needs to go to. We don't have neurosurgery where I work, so we get somebody with confirmed cauda equina, we ship them out to a hospital that has neurosurgery. So one of the things that I was taught when it comes to cauda equina, like when I have somebody that has any type of numbness or tingling in their lower extremities without known trauma, and they're having like low back pain, one of the things I always ask is, have you had any loss of bowel or bladder control? If the answer is yes, then it's cauda equina until proven otherwise, and a simple CT scan can show that. And if it comes back confirmed, um, then they're going to get shipped to another hospital so they can address it. Um, if you go to the Google machine and search for cauda equina CT results, it shows you a really good representation of what it looks like. Oh, let's see here. I've reached that point in my life. If a book doesn't speak to me, like if I'm not enjoying, I'll tell you, and I'm embarrassed to say this. So, Fight Club, the book, right? I love the movie, and I started to read the book. I can't get into it. It doesn't grab my attention and make me want to keep reading. And so I have started that book, picked it up, read, and then like I'll put it down and I won't read it again. It just doesn't, it doesn't speak to me. Again, is that bad? Hang on, Daniel. Let me go back and check. So I had a seizure in the ER 9 years ago and was given Ativan, but it made it worse than was dosed. What do you mean? Then was dosed? Oh, more. Oh, Des or Wester. Morphine was crossed off because I spelled it wrong, and I just transposed letters. I do that sometimes, and I was like, "Dang it!" I was like on the very last one, right? I had done so well, and then I get to the last one, and I did the letters wrong. That's why I was crossed off because I made a mistake. At least I caught it, right? Didn't leave it up there. So Ativan made a seizure worse. I don't understand. Yeah, I don't know anything about that. Oh, so he actually narrates the book? I might could do that. I did Audible. I didn't think Audible is a very good deal. Like, I only got 2 credits for 1 month. I can listen to an audiobook in, like, 2 days if I'm driving, you know? And I was like, "No, I need unlimited," and I'm not. It was like, I don't know, what the cost was for unlimited was way too much, but, like, 15 bucks a month for 2 books, I can get them free from the library. What are your thoughts on Nurse Jackie? I've never watched that show. I've seen clips of it, but again, that was one of those that just never spoke to me. I think I tried to watch 1 episode and I just couldn't get into it. The actress, I'm not a big fan of her either, like, her style, I don't know. There's some actors that you're just like, "Nope, can't watch that." Are these times 5 ml or less? These are like standard doses, so whatever the recommended doses are. So Toradol would be 15 milligrams IV or 30. I think research says anything over 15 isn't really helpful, but we still do 30. 60 is for IM only. We don't do 60 IV. Pepsid, I don't forget what Pepsid is, 20 maybe. Protonix is 40. That's a standard dose. You can give more, but that's usually what we give. And then Zofran, 4 milligrams typically. I have given as many as 8 at a time. And then morphine is typically going to be 4. Most other countries, way I understand it, weight-based dosing for morphine. We don't do that here. We kind of start with 4. So a lot of times they'll do like give them 4 and 4, 4 Zofran, 4 morphine. Lots of comments. I apologize. I'm not ignoring anybody on purpose. I'm just answering questions, and then by the time I'm done answering, there's more questions, and that's great. However, I can't get to all of them. I'm doing my best. Paramedic Darren John Smith, good morning. Got it up and running, man. Uh, Paramedic Darren John Smith, if you don't follow, just at 50,000. Congratulations, man. But he's the one that encouraged me to get one of these. He does a lot of these whiteboard education things. And he was like, just do it, man. Stop talking about it and get it. So I got it. And here we are. Now I got to like put new stuff on there. We get like maybe a wheel, and I'll fill out a bunch of these and we'll just spin it, right? And we'll spin it and be like, all right, what are we going to learn today? Spin the wheel. Hospital, my sugar hasn't been over 140. That's a good thing, right? We don't want it over 140. 70 to 110 is considered normal. Slide my camera over a bit. Which way? I'm looking at the preview. I can see everything. To your right. To my right? Oh, so you can see it better? Like that? Is that better? Is that better? Oh, see, I can see the preview, and the preview looked fine. So maybe it looks different on the actual phone. Awesome. Thanks, guys. Appreciate that. Yeah, I kind of like have a limited space. I might have to like start and like expand the studio out a little bit. Ah, there we go. Love it. Have you ever had to do chest compressions? Yes, I have done lots of chest compressions. What's under fentanyl? Oh, morphine. I guess this thing here is in the way, isn't it? Move that up here, maybe. There we go. We'll move that above my head. There you go. Is that better? We're learning, right? We're learning. We're doing this together. What electives do you wish you took or found to be most useful, underrated during nursing program? So I did nursing school a little different. Already had a undergraduate degree from another university, and most of those credits transferred. So I basically started nursing school as a junior. So I didn't have to take freshman and sophomore year in nursing school. I did that in my previous degree. So yeah, I did a little bit different. Where's Dilaudid? Dilaudid's on part 2. This is part 1. There are dozens of medications that they recommend pushing slowly. I was trying to keep it big enough that y'all could read, so I could only do like 6 at a time. Dilaudid's on there. We're gonna do Lasix on the next one. We'll do that. Hopefully, do that tomorrow, and I will write up another list. What other medications do we push slowly? Lexi is a first semester nursing student. I am a clinical instructor for first semester nursing students, and I absolutely love it. I have great students. Nothing but rave reviews from the nurses they're working with, which is wonderful. Definitely want to do it next semester, and I will. But I think they set the bar so high. Both the staff and the students have set the bar so high. It's going to be like, well, you're gonna have to do a lot to really top that, right? Because these students are outstanding, very motivated, looking for things to do, asking me questions constantly. Um, really want to get out there and do all the things, especially as a first semester nursing student. How fast do you push potassium? uh, I'm not even gonna answer that. Huh? Now the real question is, how do we mitigate the burning with with a potassium infusion, right? What's the best way to do that? I know you can slow it down, but in my experience, slowing it down does not really make it much better. Adding normal saline as a 1-to-1, so if you're running 100 ml K-Rider or potassium, run it 100 ml normal saline at the same rate for an hour. Again, we do that. We have to talk to the physician, make sure that we get an order from them. But I think that is probably, in my experience, the best way to mitigate the burning sensation of potassium. Why does potassium burn? It's a chemical irritant, and it's actually doing damage to the lining of the veins. Are there any cures for tinnitus, however you say it? There's no cure. There are treatments for that. At least as far as I understand, there's no cures, but there are treatments for it. Oh, this is Summa Mama. Thank you. I was asking for my daughter when choosing her 3rd year schedule. We didn't, and as far as nursing schools go, we didn't have a choice. Like, that was these are the classes you're taking, full stop. Like, you don't get a choice. So we only get to choose your first 2 years, like, whatever there were certain classes you were required, your core curriculum, and then you had some electives that you could choose. I don't even remember what electives I did when I was an undergrad. That was a really long time ago, like 32 years ago. Reglan, we can't even give Reglan anymore. They've basically taken IV and IM Reglan out of our formulary. I think the only thing we can do Reglan is PO, and so people come in, they're all upset, like, "That's the only thing that works for me." I'm like, "Hands are tied." Like, we literally don't even have it. Yes, regular at least 5 minutes should really be 10. Put it in a 100 bag. Ooh, what are we talking about? Yeah, give it. But I think the problem was too many people were doing it wrong, and they were like, "That's it." Everybody loses that privilege now. Because initially they took it away IV. They said you can't give it IV, but you can do it IM, and then they took that away too. Used to use Vistaril, which is hydroxyzine with Demerol. Man, I haven't seen Demerol in forever. That's like an old school drug. Why do you give junkie? Uh, so, I don't really like that term junkies. That's a very negative term. There are people out there that have substance use disorder, and so they have an addiction issue. So I don't like that term because it's derogatory. Like, these people have a medical problem and they need help with it. So I don't like that term. And I get both sides. Like, I got people who have chronic pain, want their pain treated appropriately. They don't feel like it is when they come to the emergency department. And that's frustrating for them. And they got other people that argue, why are you feeding this addiction? I don't, it's like you can't have it both ways. We're either under treating pain or we're giving out too many. You got to pick an argument here. I understand both sides of it, but yeah. Is Ambien really bad for you? Every medication has side effects. It's a matter of balancing risk versus benefit. If the side effects are not as bad as what you're experiencing, and Ambien is a sleep aid, then if you can deal with the side effects, but would rather have that sleep, then that's a conversation you and your physician can have, and you can try it. But it's a prescription medication, so you have to have a doctor's prescription. So that's a conversation you have to have with a physician. All right, Alyssa. Mm, Alyssa's getting repetitive. How many fights a day do you have with the ICU? Not it's not terrible. It's more the floor. The floor is the one I get a lot of flack from at my hospital. Why do nurses in the ER always downplay injuries you have? It's a very broad term, and to say that all ER nurses do that. So there's a test taking tip that we learn when you're in nursing school, and basically any answer that says always, you can rule that out because there are no absolutes. That is absolutely not true. I'm sure some do, and that's unfortunate. I can't speak for them. Veterinary nurse 220. Thanks for the follow. Appreciate that. Thank you, Holly, for muting Alyssa. She was getting irritating. Probably a bot, would be my guess. Megan, thanks for sharing out the live. Have you ever been told you can't give lidocaine when giving IV potassium? I've never given lidocaine with potassium. I'd have to look up the interaction. Do I watch The Pit? Yes. I've not watched the last episode from last Thursday, and the next one comes out tomorrow, so I've gotta get on that. I always end up, like, 2 episodes behind. Yeah, Troll Patrol. Get 'em, Ames. So I got Ames and Holly on Troll Patrol. That's right. Uh, yeah, just they come in here just to cause problems. Comments coming fast and furious. I feel like I'm gonna have a seizure trying to catch up with all the all the comments. Let's see. Have you ever wished you chose a different nursing path? Not for me. I'm a second career nurse, third or fourth career, depending on how you look at it. So I chose this as an older adult. So I feel like I was fully aware of the consequences and the risks involved. Now that was before COVID. So I didn't anticipate a global pandemic that would almost, you know, take me out. But yes, I knew what I was getting to. It wasn't like I was an 18-year-old going to college and like, "Oh, I'll do nursing. This will be fun." I was 38 and had the full power of the internet behind me to do all my research. So, why push Pepsid? So Pepsid's famotidine. Famotidine is actually an antihistamine. It's an H2 antagonist, and it's actually preferred over Benadryl in most cases of like allergic reaction. So yeah, famotidine is probably what most people know it by, but Pepsid's the brand name. But we give that for like allergic reactions. I still have doctors that give Benadryl too, but I don't think that's first line treatment anymore. How realistic is the show The Pit? Pretty realistic. As far as TV dramas go about life in a busy level one trauma center, yeah. I mean, they take dramatic license, they add some, chaos that probably doesn't need to be there. A lot of drama, personal drama. I don't really see we don't really have a lot of that personal drama, but it's a TV show, right? They want you to connect with the character, so you got to have some drama. Ames is telling somebody to go see a neurologist, so that probably if Ames says to see a neurologist, that would probably be my response too. If you're having neurological issues, you need to see a neurologist. Best scrub brand? Ooh, I like this question. I've never gotten this question before. This is obviously subjective, right? Depending on what your style is. My best scrub brand is Carhartt. Their Carhartt Force Flex are, in my opinion, the best scrubs out there. They're kind of stretchy, which is good, give you room to move. They last forever. I've got like 12-year-old pairs of scrubs, and they're still going strong. I mean, I should probably get rid of them. They've got bleach stains on them. Like all my scrubs from COVID all have bleach stains because that's the only thing we were allowed to clean with was bleach. So they all have bleach stain. I don't care how careful you are. There's going to be drops that fly that you don't see and they end up on your pant leg. So that being said, I just ordered Landau, a pair of Landau scrubs because that's what the nursing school uses. So I have a nursing school scrub top that has the nursing school logo. And then I had to order the pants separate. They're joggers. Never worn joggers before, so this will be a new experience. I'm gonna be like Steve Buscemi and like the skateboard and be like, "Hello, fellow kids," trying to fit in. Yeah, I have a pair of figs, and I like those too. The only thing what I really like about Carhartt is I like having an actual belt, and the scrub pants for Carhartt have belt loops because I carry my Leatherman Raptor and I have it on a clip, and that needs a belt. It's heavy, so I don't like to like shove it in my pocket because it drags my the ones that I don't have a belt for, like my figs. I don't wear those very often because I have my Batman utility belt. I got a lot of stuff I keep on there. Yeah, I love Carhartts. I I have I have a pair. I had a pair of Cherokees, those are terrible. Um, I got a pair of the Landaus coming. They're supposed to be here today, but I like the scrub top. Lots of pockets. The more pockets, the better. What's my most memorable case? Oh gosh, memorable case. Well, there's two ways to look at that. Because I worked ICU and my most memorable case is the patient that I had. It was a younger woman, like in her 30s. I forget. This is a long time ago. It's like 10 years ago. I don't remember precisely. It was one of my very first patients as a new grad ICU nurse. I don't remember what the disease process was, but she was in a bad way. Very sick, so sick that we could no longer care for her appropriately. We had to transfer her to a larger hospital. We had her maxed out on pressors. She was intubated. didn't look anything like she did when she came in. She's like very swollen, edematous. And I was like, this is not going to end well. And it was heartbreaking because she was a little bit younger than me at that point. And then like 6 months later, her and her husband come back in the ICU. I didn't even recognize her. I recognized him because he was with her so much. And they came in to thank us. She made a full recovery. And um, I guess in some small way, we didn't make it worse. Like we kept her alive long enough to get her to a higher level of care. I had her for like 3 or 4 days in a row because that was back when I would work 5 straight. So I had her for many nights in a row. And that was, I mean, that was a memorable one. I still think of that one. Let's see. Oh my gosh, I'm just gonna start. I can't keep up. Ames is in here answering questions. That's great. I saw paramedic Taran John Smith was in here. If you're still in here, John, when I was telling my students yesterday, they were asking me some questions like acid base and um, compensated versus decompensated. And I was explaining, and I said, a really good reference would be this friend of mine, paramedic Taran John Smith. He does a lot of these great kind of like whiteboard videos and they said, "Oh, is that his real name?" I was like, "Paramedic to RN?" "No, no, John Smith." And I was like, "Yeah, that's his real name." I was like, "Oh, okay." I was like, "Yeah, it's, easy to remember." Yes, it's those kind of stories that I think, especially being early in my nursing career, having that experience, I think helped validate that I did the right thing, that I chose the right career because that's really what I wanted. I wanted a career where I felt like I was helping people. I had a job at a university where I was helping them raise money to buy more stupid things, like build more buildings they don't need, name another building, create another fellowship for some professor. And I didn't really feel like that was benefiting society. It was benefiting a university that was making money. So I wanted out and I got out and I decided to do something where I could actually help people. And one of the things, John, as a instructor that I've learned to do a lot is say, I don't know, because they ask so many good questions and there are a lot of things I don't know. You can't know everything. So I'll say, all right, let's go look it up. Let's look it up together. We'll learn something together. Meg, thanks for the follow. Ivo, thanks for the follow. So I had to return. I bought one of these Hoheim gimbal cameras, from the TikTok shop, and it had really good reviews. And mine stopped working after like 2 weeks. It wouldn't charge anymore. I contacted Hoheim. The communication was okay. There's definitely a language barrier there, but at the end of the day, they took it back, paid for the shipping to send it back, and then today they sent me basically a coupon to get another one. I read it's an issue with some of them, so hopefully the second one will be better. But I do like the gimbal part of it where it can like stay level no matter what you do. And when I go down to Tennessee and go to Dollywood soon, we're going to take that and take a tour. Yeah. Oh gosh. Yeah. And that's one of the things, like, there's so much I know enough to know I don't know a lot. Oh, I love Dollywood. I was skeptical when we went there the first time because I hadn't been since I was a kid, like, not since they opened. Because Dollywood's 40 years old, so I think I went there when I was, like, 10 years old when they just and it wasn't what it is today. That park is amazing. That is a amazing park. The rides are so good. I was really surprised how good the rides were. Wild Eagle is probably my favorite. Oh, the cinnamon bread? Yes, you gotta get the cinnamon bread. That stuff is, like, dangerous, like, I could eat the whole thing by myself. I don't advise doing that, but I could. I would love to meet Dolly Parton. I think she's just, one of the good human beings that are still out there. She's done a lot of good. Like, her children's book, Free Books for Kids program is amazing. Yeah, we got season passes to Dollywood. We always stay on property, at one of the resorts. Dreammore is probably our favorite. We stayed at the other one, and it was okay, it wasn't as good. The Dreammore is really good. And, like, in the hotels, like, the resorts, they have, like, m museum aspects everywhere about her life. Oh, really? She has a makeup brand and the proceeds go to the library? That's awesome. Oh, if you've never been, Austria, you gotta go. I think it was actually voted, like, the number 1 theme park in the country. I've been and, I've been to Disney World in Florida, and it's great. I loved it. And if you're, Avengers and Marvel and Star Wars and all that stuff, it's a great park to go to. But in terms of rides, the rides at Dollywood are top notch, like really good rides. Kennywood, Kenny Rogers. I don't know if he has one. Oh, she just bought the children's hospital in Knoxville. Oh, that's awesome. Only good things will come of that, I would imagine. And she bought her company bought the one something up in Pennsylvania. Oh, that'd be good. Yeah, we just have a great time when we go there. Let's see. The only ride I don't advise is Whistle Punk Chaser. That will rattle you to the core. Like, not good if you're older and have back or neck problems. Do not advise that. I thought it looks pretty benign, and the first time we went, it was right after I had like, literally days after I had my neurological event, which I guess ultimately was hypertensive encephalopathy is what the diagnosis was. But, like, I had to take it easy, and they were like, "No, you can't not until you're cleared. You need to have your, brain MRI, MRA, you need to have all your other testing done before you're cleared to ride any roller coasters." And I'm like, "Okay." So there was one, I was like, "That's little. That's not that bad. It's like a kid ride." It was not a kid ride. I got off of that, I was like, "That was not a good decision. Should not have done that." What do you think about peptides? Well, I think there is a place for them. I saw some news that is kind of scary. Hey, Christopher from the Blakery content. What's up, sir? Good morning. There's another good one to follow, especially if you're pediatrics, pediatric trauma, pediatric emergencies. He's a good one to follow. Um, so I saw that the current administration, RFK Jr. has said that they are going to relax the rules on peptides and reverse the decision that is currently in place, which could open the door some less than reputable peptides. Now, I think peptides have been around. I think there is a place for them. I think the issue becomes safety, like where are you getting them from? So I think that is the issue. And I think as long as you are, good with your research and in consultation with your physicians, then I think that is something you can have a conversation with. Now, well, maybe we need more of them. I mean, as I understand, peptides can also just be like when you take GLP-1s and you mix them with like B12 or something like that. That's not very evidence-based of you. Oh, I do like that. Yeah. I saw that news last night. So, Zamora, good morning. Welcome in. How are you doing, friend? JP, thanks for the follow. Decadron. Oh, is Decadron? Is you talking about need to add that to the list? Dexamethasone is another one. That's the fire crotch one. What do I think of Zofran? I think it's an antiemetic. I think it has a lot. We give it almost every day. Every day I work, I give Zofran. I think if it works, it's great. They do recommend you push that one kind of slow as well. Tired but doing okay otherwise. Well, that's good. Furosemide, Lasix. Yep, that'll be on part 2. That'll be on the next page when I get that one done. Got to push that one. So we actually, a student actually got to give that yesterday and learned that you got to give it slow. What's the one opinion on gabapentin? I think a lot of patients I see are on it. I think it has it's a useful medication. It's a controlled substance now because it's a potentiator. So if you take it in conjunction with opioids, it enhances the effect of the opioids. And that is why it is now a controlled substance because people were taking advantage of that. Have you ever done an IO? Yes, I've done an IO. Easy IOs mostly. We don't use easy IOs anymore. We switched to the Neos, which are like an auto inject, which I've used twice and I didn't have any problem with them. However, I have seen other people say that they have a high failure rate and can break. So I never had any issues with an easy IO. I wish they would just give it back. Protamine sulfate. Isn't that the antidote for heparin? Is that protamine sulfate? That's the like the reversal agent for heparin, isn't it? Morphine, I usually push morphine over 2 minutes, but I've never pushed it over 5. Yeah. That's the recommended. You feel like GLP-1s are gonna have a lots of bad long-lasting issues later? I hope not. I really hope not. Fix that first page or I will riot. Is that better, Ames? I'll redo it. I made it to the very like, look how neat all this is, and then, like, I got to the last one and my brain just, like, shut down. Look, I transposed some letters. I do that. I can't help it. I'm sorry. But I made it too far and I was going live. I had to finish it. But yes, I will fix it. It bothers me too. I will fix it. I promise. Again, like I think I don't know. You can't see the like the pencil line, right? I tried to draw a faint pencil line because there's no way I could do this that neat on my own. But I didn't want to be able to see it on here. Yeah, I can't really see the pencil line, so that's good. That's good. Oh, let's see. Oh, we doing antidotes now? Vitamin K, yep, for warfarin. I've given that. Benadryl burns so much if you don't dilute and slow push. Oh, really? Interesting. So whenever I get to Benadryl, typically it's part of a migraine cocktail, which means they already have usually fluids running. So I'll just run it in through like the Y port and push it slow, and then just dilutes with the infusion. That's a great way to dilute medications if they already have a normal saline drip going. Oh, wait a minute. Did I miss something? I missed a lot. Yeah, they took our easy IOs away and they gave us these Neo, they're called NIO Neos, and they're like an auto inject. So basically you hold it down to where you're gonna go, you lift up, it's got like two little like wings on the side, you lift up, twist, and then basically like push down and it injects it really hard into their bone. I've used it twice, it worked fine. Um, but easy IOs are like easy. They're super easy. How fast do you push epi? For, like, code epi, as fast as you can. If you're doing push dose epi, again, it doesn't like, there's no I don't think there's any restriction on how fast you can do that. You don't have to push it fast, but if they're in a code, they're not they're not getting any deader, so push it. But if you're doing, like, push dose epi for blood pressure control, again, I don't think there's any reason that you couldn't just flush it, like, push it in and flush it. The only medication that you absolutely have to push fast is adenosine. And I think Ames mentioned there's a case for atropine in a bradycardic arrest situation. You can push that fast too. Typically, IV Pepsid is not. I don't give it for acid reflux. We give it because it's an H2 antagonist. It's actually a better option according to the evidence. It's a better option for antihistamine treatment. Do your students watch your lives? I don't know if they watch my lives. I do know that a couple of them follow me, and one of them told me that oh, one of them told me that their mom followed me and mess was gonna like actually sent me a message to let me know I was gonna have her daughter as a student and then deleted the message. And the daughter was like, I'm so glad you deleted that. That would have been mortifying. I don't have any opinion on the oral. I don't know enough about it. I read the report that came out that said the efficacy is about the same. So I think for people that don't like to do injections, I think that's a wonderful option. But in terms of, I only know what I read and when the story came out, so it seems like a really good option. But outside of that, I mean, I've read the same thing everybody else has read. But I mean, there are people out there that don't like doing injections, and so if you can give them a pill that they can swallow, then that's probably a better option. I don't know. I don't know why they took I think it was a contract. They probably like, "Hey, we just signed a contract. We're gonna buy this from this company, and we're getting rid of the EasyIOs." They definitely did not consult the nurses on that, because if they did, we would have rioted. Like, "No, give it back." I've never had an EasyIO fail, ever. I'm in a hospital, and they don't slow punch at all. Oh, slow push. They don't slow push at all? Yeah, that's not good. There are a lot of meds that need to be pushed slow. I don't make the important decisions. That's what we say, and you will know this, Ames. That's above my pay grade. It does the auto inject is only for adults. I don't know, we don't take care of kids in my hospital, so I don't know. Which we've made the argument, technically we can. We are a public ER. If they and we've had kids come in, parents have brought kids in because they Googled nearest ER and they come to us. So I feel like we should have a pediatric option available, and those neos do not do that. That is only for an adult. What meds do you slam? Adenosine. That is it. That's the list. In my 10 years, that's the only medication I've ever slammed super fast. Like, had to, because it's got a very short half-life. You have to push it fast. I did not know that, Mark. That's interesting. Now I gotta look it up. Trust but verify. We'll do origin to the Google machine, Ames. Warfarin name origin. Let's see. According to the Google machine, it is indeed the warfarin is derived from the acronym WARF, or Wisconsin Alumni Research Foundation, and the suffix arin, A-R-I-N, is from the chemical class coumarin. Coumarin, not coumadin, coumarin. It was developed in the 1940s by Carl Paul Link and his team at the University of Wisconsin to combat a bleeding disease in cattle caused by spoiled sweet clover. How about that? Mark dropping some knowledge on all of us. Appreciate that, sir. This is Madeline. I'm a new grad in the ER who gave adenosine for the first time, and I was stressing. Oh, yeah. I remember those days. Yes, you're right. And as soon as you give it, you have to flush it. And the recommendation is 20 mLs of normal saline. So you get a 20 ml syringe, pull it up. You can, whether you usually just pull it from a bag. You just spike a bag, pull it up, and then put a three-way stopcock, do your adenosine, switch the stopcock, slam your saline flush. Now, I have seen there is some research out there that suggests that pre-mixing your adenosine with 20 mLs is just as effective. Again, it depends on what your hospital protocol is, so always follow your hospital protocol. But they have done research on that and found that the efficacy is the same. Is that a compliment? It was. I love learning new stuff in here. I tell my students though, I trust what you say, but I need to go verify it for myself. I just don't take it at face value. Is a GI cocktail bad for you? No. I mean, as long as you don't have any allergies to those medications, and GI cocktails come in different flavors, right? There's a combination of meds that physicians will use. And if it helps, then no, it's not bad for you. Let's see. Michelle O'Kitty. Yeah, I got a fast push of combo Reglan. Oh, you should not put fast push either of those. Yeah. No, definitely not. Toradol burns. Like, I think Toradol is minimum, what, 30 seconds? Did I put that on there? Yeah. Oh, no, 15. More than 15 seconds. Preferred is 1 to 2 minutes. If they've got normal saline running, what I will do is I will connect it and I will like pinch the tubing at the distal part and let the infusion backfill the Toradol and then dilute it. And then I'll open it back up and then slow push that so it doesn't burn. Emma, thanks for the follow. Appreciate that. I know of at least, I know, going back to the students, I know 2 students that follow me. There might be others, but they actually had their name on their profile. I don't know if the other ones don't have their name, then I may not know who they are. I definitely don't know who the one's mom is. So I've got 37,100. So I don't know all of them. Chemlock, thanks for the you're awesome. I appreciate that. IV Toradol made you hallucinate? That's wild. I've never heard of that before. Thank you for the roses as well. Candace, thanks for the follow. HTTP Danny, thanks for the follow. Appreciate that. Does anybody oh, Amanda Donnell is in here throwing out shares. Appreciate that. And that's with a CSF leak. I never knew it could be that bad. Ooh, CSF leak. That's not good. They have to do a blood patch for that. Potassium and magnesium burn bad too. I need a slow drip on those. Yeah, so does slowing it down work for you? Because in my experience, slowing it down doesn't really help that much. Mixing it with normal saline does. It also depends on how long do they want to be there. Oh, Paramore. Love Paramore. Diane Farmer's in nursing school. Any advice? Stay on top of your assignments. Make sure you get I like a actual calendar, like a physical calendar. Write everything down, your due dates, you get your syllabus at the start of the semester. You write all your due dates down. Stay on top of your email. You got to check your email all the time and make sure you're aware of everything that is happening when your due dates are. You know, they don't take excuses. If you miss a deadline and it was on the syllabus, that's your problem. And their sympathy level is very low, at least in my experience. It does help slowing it down. Okay, that's good. I've tried slowing it down to like 75 mLs per hour instead of the 100, but they always still report burning, at least anecdotally in my experience. So I'll always ask the physician if I can just run some normal saline with it. And they're like, yeah. So I'll do like 75, slow it down, and then I'll add 100 mLs per hour of normal saline as long as the physician's okay with it. What is a morphine cocktail that you use? I don't really, we don't usually use it. The only, I don't know, morphine cocktail. What we do like 4 and 4, 4 Zofran, 4 morphine. Is it with regards to what? Is it weird when your patient is a doctor? I don't get that very often, but it'd be like being a patient as a nurse, like, you know enough to know. It depends on what kind of doctor they are. I mean, if they're an ER doc, yeah, that's kinda weird, but I've never had to do that. So I thought I was having a reaction to Toradol, but maybe the nurse just pushed it too fast. Yeah, it could be. You definitely I mean, 15 seconds, at least 15 seconds, preferred 1 to 2 minutes. Yes, I go live almost every weekday morning, usually and sometimes on the weekends too, 6:30 most weekday mornings except when I have clinical. And Fridays. Fridays I can't go live at 6:30 because my kids have to go to school early. And so that gotta be up and ready to go earlier. Am I a bad patient myself? I don't think I am. I've been a patient a few times. I had acute appendicitis while I was at work. I was actually charge nurse that day, so I was waiting for CT results, so I was literally still I was walking around, still working with my IV pump. Sorry, not morphine. Wait, what migraine. Oh, migraine cocktail. What's the migraine cocktail? Um, it depends on the doctor, really. There's one doc that loves to do mag and will do mag. Others will do Benadryl, Toradol, Compazine, and then fluids. So there's always kind of like Benadryl is always in there. I feel like Compazine is always in there. And then sometimes I have a physician that will do mag, a mag infusion, which actually tends to work. Ames, thanks for the go populars. Appreciate that. Stephanie, thank you for the follow. JB, have you heard of the rare cases of cardiac arrest after IV? Yes, I have heard that. That happened at a hospital I worked at, and that is the reason why we cannot do push Rocephin. We used to have to mix it up and give it over 6 minutes. People weren't doing that. They were pushing it too fast. They didn't want to do the 6 minutes. That happened to 2 patients where I worked. And immediately, like literally after the second time, they moratorium on IV push Rocephin. Everything was in a bag over 30 minutes from that point on. What? Look at that. A woolly hat. As a bald man, if Christopher's still in here, bald men carry hats everywhere. Year round, you have a hat with you at all times. Baseball cap, beanie cap, doesn't matter. Woolly caps, I love woolly caps. Is a 4-minute seizure considered long? I think 5 minutes is considered the threshold, is what we consider status epilepticus, like when it goes over 5 minutes. Now, 4 minutes, like for a clinician, that's still a really long time to watch somebody having a seizure. And hopefully we've done something to address that, whether it's, you know, IV Ativan or rectal Ativan or something like that. Yes. Yep, and that is why we can't do IV. The only type of, injection we could do for Rocephin is an IM injection. Everything else is in a bag over 30 minutes. Yes, nitro IV, yes, all the time. Nitro requires a special type of tubing called low sorb tubing. The standard tubing is made of PVC, which actually absorbs some of the active ingredient of nitroglycerin. So we have to use a special type of tubing that's polyethylene or something like that, but it doesn't absorb. It's like less than 3%, so it's negligible. So yes, we do IV nitro regularly. I don't know if our nitro comes in a glass bottle or not. I can't remember. Um, it makes sense, but if it came in a bag, it would have to be in a special type of plastic, the low sorb plastic. But it probably does come in a vial. I can't remember. Why is Pepsid so slow? You did one over the day, 3 minutes. I don't I don't know what happens if you push it too fast. I'd have to look it up. Some of them I do know, like what happens. JB, thanks for the follow. Appreciate that. I found Zofran to be super effective for my nausea. Good. Is there any efficacy or addiction? No, no. Uh-uh. Not as I understand it. Like, I don't think you build up a tolerance to Zofran. Um, and I've not heard of any addiction issues. It's not a habit forming. Rocephin is commonly given prepared in 20 to 30 mLs and given over 5 minutes. Not at the hospitals I work at. Nope. They come pre-mixed, or ours come pre-mixed. No, no, no. We have those roller bags now, like where it has like the separate containers. So you have to like roll it to pop the mixture, like the D5W into the powder, mix it, and then you roll it again to open it up to the drip. So yeah, we don't do that anymore. We don't do push anymore. And that's why I mean, again, that happened at a facilities. The facility's like, yep, we're not doing that. Can't trust the nurses to push it slow, so nobody gets to push it anymore. So it's not even an option now. Now, your hospital may do that because maybe your maybe your nurses follow rules better. The only meds I'm super slow with are Decadron, Reglan, and Compazine and beta blockers. Oh yeah, I think I've got metoprolol is going to be on the list as pushing slow, but that's on. There's like part two, part three, part four. There's a lot of meds you got to push slow. I got to write it big enough so you can see it from the camera. I can't put them all on here. Dilaudid, yes, Dilaudid needs to be pushed slow. I think that one's 2 minutes, at least 2 minutes. Most opioids, with the exception of fentanyl is at 1 to 2 minutes, at least 1 minute. All the other ones all the other opioids are gonna be at least 2 minutes. But that's part 2. We got more. This is just, this is just a teaser, right? And I'll fix this, Ames. I promise I'll fix this. I'll redo this page. And see, unlike paramedic to RN John Smith, I don't have a wife that will do this for me. Like, her handwriting is pretty good. Like, it'd be better than mine, but no, she's got other more important things to be doing than whiteboards for my live stream. Do you love setting up your Plurivac system for chest tubes? I actually have not set up a Plurivac. We use Atriums, and I've not set one up in a hot minute. One of my students, two of my students got to see a chest tube insertion yesterday, so they got to see that process. I would I would have to go back and watch the video again. All right, gotta do the puzzle piece. Bear with me. Nope, I didn't do it good enough. There we go. Mission accomplished. Once you go live for like an hour, it sometimes makes you do a puzzle piece. How about Ativan when someone's having it? Yeah, that's our first line treatment for a seizure is Ativan. As a ex-addict recovering, we like when they pushed a lot of. Yes, I've heard that as well. They prefer that you push it fast. They like the high, but it's not good for you. And people that don't know that feeling, actually can get sternal, like, chest wall pain. No. John already talked about this. We do not do potassium fast. Oh my gosh, that'd be horrible. 'Cause so potassium is a chemical irritant and actually damages the lining, and the faster you push it, the more damage you're gonna cause. So, yeah, definitely don't do that. Justin, what's up? You like this? What, the music or the whiteboard? This was John's doing. Paramedic Arn John Smith has been pushing me to do this, so I was like, "Man, I don't wanna steal from you," and he's like, "No, man, do it." I'm like, "All right, man, I got John's blessing, so we're gonna do it." Now it's I gotta actually do the content, right? But we're gonna get part 2 up. We'll try and do that tomorrow morning. GK Borgi, thanks for the follow, appreciate that. So we got another, like, 10 minutes, 7:45 is when I gotta jump off here, get a little workout in, and then get the kids off to school, and then I'm back at work today for the first time in a week and a half, almost 2 full weeks off. So, yeah, it's the music, yeah, today's pop punk. We've been on a grunge kick, but I also dig the early 2000s pop punk. Have you ever diagnosed a student of something during class? No. I've had a lot of students when I was in nursing school, a lot of my fellow students, they, like, raise their hand, "Oh, I have that." "Oh, you do? Okay. Sure you do." But, I think that's fairly common. My uncle is a cardiologist, and he's told me stories about when he was in med school, how you're learning about a disease process, and then you convince yourself that you have it. It's a fairly common phenomenon. Best medicine to help pain attack that works? It depends on it depends. Are you saying pain or panic? Pain? It depends. What is the source of the pain? Migraine, like, for example, migraines, opioids are not really gonna help with that. Good morning. How are you today? I'm good, Kelly. I got some decent sleep for the first time in a couple nights, so that was good. And I'm back at work today, dreading that because I've been off for long enough to know that I will be in one of two places. I will either be in triage, which is the bane of my existence, or I will be in quick care, which is my second bane of existence. So it's going to be one of those two, and it's going to be one today and one tomorrow. So I'll be doing nothing but triaging patients for the next 2 days. And then I'm off for the weekend, which is good. How often do you see Toradol allergies? Very rarely. In fact, I can't even think of a time where I've seen somebody allergic to Toradol. I mean, it obviously happens. It's just in my experience, I've not seen that. So what's the difference between triage and quick care? So triage, I might have said fast track, but it's quick care. So quick care is like a Med Express. We have a clinic that is for like lower acuity stuff. So, sprained ankles, my shoulder hurts, I have allergies, whatever. That is basically triage because that's all you do is you triage those patients, you do your triage note, and then they're usually discharged before you even finish your triage note. And you average 7 to 9 patients per hour for the whole day. And then, so that's just a grind. All you do is type notes the whole day. And then triage is in the main side ER where you're triaging all the ER patients. So, and that's also kind of pretty steady. Mimi's allergic to Toradol. Oh, why is this pushed more? I don't know what you mean, why is this pushed more? Does No, ibuprofen, that's really bad for you. You should not do that. Don't do that. Real quick, down and dirty, why do you push Pepsid and Protonix slow? Um, I don't know. I used to know. We have to look it up. To the Google machine. Let us look. Prevent severe adverse reactions, including hypotension, chest pain, and cardiac arrhythmias. There you go. It's one of those things I look up and then I forget. Let's see. And the same thing with Protonix. Hypertension, low blood pressure, and this one is just to prevent hypotension, especially in cardiac patients, and to reduce the risk of injection site reaction. Rapid administration of Protonix can also cause negative hemodynamic response, including potential cardiovascular complications. Kind of vague. Yeah, I think Toradol is it irritates the veins. But let's look it up to verify. Yep, to prevent intense burning or stinging sensation. That's why, because it burns. It burns us. No, we will not do that. I have a really bad migraine. Can I take 3 Tylenol? You can take I wouldn't take more than 1,000 at a time. Max is 3,000 milligrams per day. So I would not take I would say 1,000 at a time every 8 hours is the recommended dose. As long as you don't have any kidney I mean, not kidney, any liver issues and your doctor says it's okay for you to take it. Cat with the cats, thanks for the follow. Morphine, because if it's pushed too fast, it can cause, chest wall pain, which can mimic, like, a heart attack chest pain, and we don't want that. No, and getting it fast is not good. It'll make you feel really, really bad. Unless you have substance use disorder and you have an addiction to it, then you probably do want it fast because it gives you a high. Is ketamine a slow push? Yeah, it's ketamine, depending on what you're using it for, but yeah, I don't think there's any instance where you would rapid push ketamine IV. So it depends, like if you're what you're using it for. But all of those cases, the dosage will change, but the push I think is still going to be the same, nice and slow. There's no need to slam it. Correct me if I'm wrong, which you will, but in my experience, I've never pushed ketamine fast. Raves don't count. Oh, what did they disprove? I missed something. Yeah, that's always the question is like when you get these small doses, like say Dilaudid comes in pre-filled 1 ml, 1 milligram syringes. How do you push that over 2 minutes without diluting it, right? But I'm telling you, that's just the recommendation. Like what you do and what your hospital policy is may be different. A lot of times our medications, when they have a specific push rate, it will say that in the instructions. Ketamine it does scare me a little bit too, because the dosing really is very weight specific and depending on what you're using it for, conscious sedation, whether it's, awake intubation, the dosing is kind of varies and you got to find that sweet spot because otherwise they get sent down the K-hole and that's a scary place for a lot of people. I've never been there. I've never had it. I don't know, but I've given it to people who have gone down to that place and they don't like it. Like, I mean, they really don't like it. They come out of there and like they're scared. They're like, I don't know where I was. That I don't want to ever go there again. Like, don't do that again. Yes, that's they couldn't really explain it. They just said it did not feel good. Do not want to go there again. 0 out of 10, do not recommend. So yeah, we're getting lots of comments in here. Do not want to go there. It's terrifying. Don't do that. Yeah, medical PTSD is a real thing. If you've had a really bad experience at a hospital or emergency department, that can affect your ability to go back in the future. Yeah. Ooh, what a great way to end the live, right? Blink 182. Thank you for the follow, Faithia. Appreciate that. Let's take a look at the numbers. Really good crowd in here. Well over 150 for the duration of the live. That's amazing. That's a great, great live. And it's one of the most well attended lives I've had in a long time. 3,500 unique viewers, 108 new followers. That's amazing. We will do this again. I'm live most weekday mornings at 6:30. Um, so yeah, we will be back tomorrow morning, 6:30. I usually try and go a little bit early. I've been better about getting there on time and even going a little bit earlier. And then you'll catch clips. I'll post some clips later today. Schedule them out to get published throughout the rest of the day. And you can always follow me on my other channels. I'm Gary the ER Nurse pretty much everywhere. You can find me on Instagram. You can find me on Substack. I'm also on Facebook. My Facebook page is really growing. It's over 11,000 now. It's amazing. Ames, thank you so much for stopping by. Thank you for moderating and keeping those wackadoos in check. I appreciate that. Holly is also one of my moderators, and she also did a great job today, as always. Thank you so much. Before we go, I always ask any birthdays coming up. If anybody's seen Doc in here, I haven't seen him in a hot minute. His wife was supposed to take the NCLEX on March 26th. I've not heard any updates. So if anybody knows Doc, let me know. Tell him I'm asking about it. See how his wife did on her NCLEX. He already passed his, so I was waiting to see what she did. Any birthdays, anniversaries, celebrations, passing NCLEX, taking the NCLEX. Away to me. Thanks for stopping by. I'm glad you got to come in. Thank you for participating, asking questions, answering questions. Love it. Renha, thanks for the follow. Mark's so old it took my boards with a pencil in a huge room, about 1,500 people. Wow. Yeah. That's yeah, you're pretty old, dude. No, just kidding. It was a different time. That's how I did my EMT. When I took my EMT, it was in a room full of people with paper and pencil. All right. Last chance. April 13th is your birthday. Cat with Cats. Happy early birthday. Next week. Miranda, no, I'm a EMT. EMT basic since 2003. Mark, enjoy the conversation. Love to have you back, man. I appreciate you. Stay safe out there. Yep, LASIX is on the next part 2. There's a part 2, a part 3, part 4. So you got to tune in tomorrow to catch part 2. We'll cover some more. This is by no means a comprehensive list. It's just 6 of them. We got a lot more. Miranda since 2012. Awesome. Very cool. I thought we were ending on Blink 182, but we went over a little bit and we moved into another song, but that's okay. That's how we roll. What a great live. You guys have been a great crowd, great audience, lots of good questions, lots of new knowledge, which I always love. I will take that on and pass that along to my students at the next clinical. Until tomorrow morning, remember, be kind to others, be kind to yourself, prioritize your mental health. I'm Gary, the ER nurse. We'll see you tomorrow morning. Have a great day.